Also, in your health news, we are turning to a study all about breast cancer. Often, the time between diagnosis and treatment can be overwhelming and filled with anxiety. And it's why researchers at the University of Iowa's Holden Comprehensive Cancer Center are launching the new study to figure out how health centers can better help patients in that position. We spoke with one of the study's lead doctors, new tonight, here on The Current. And it's why we are joined by Dr. Ingrid Lizarraga, breast surgeon at the University of Iowa Healthcare. Thank you so much for being here with us.
Thank you so much for having me.
This seems like an obvious question, but what was the need that you were seeing that wasn't being met when it comes to this period in between diagnosis and treatment?
Well, when we talk about breast cancer diagnosis and treatment, it's very complicated, and we often focus on getting the right tests, making sure we're doing the right treatment. And sometimes I think the patient kind of gets lost in the shuffle. It's a terrifying thing to have an abnormal study or to find a lump in your breast. And then often the process is complicated, and there's a lot of tests and a lot of visits and a lot of doctors. And just the waiting in between can be really hard. So we were focusing on trying to see how we could make that experience better, and we wanted to start by focusing on what the pain points were.
So, how do you do that? How do you conduct a study like that?
Well, we need people, we need patients. So we were funded by Team Breast Friends, which is a local advocacy group. So we were very grateful to them. And we found some brave patients who agreed to be interviewed. So what we did was came up with an interview guide that kind of probed into this. And it was very simple. We just said, tell us about your journey. Tell us about what it was like from that very first lump or mammogram or whatever till the time that you started your treatment. What was it like? What did you feel? What was good? What was bad? What was easy? What do you think would have helped?
Mhm. So, now from those results, what do you do?
Well, we identified some kind of key areas where it seemed like was common for points of pain and opportunities, but it was a very small number of patients. So what we'd like to do is interview more patients with more diversity in both the patients themselves and also the experiences that they had, in order to be able to come up with some actionable things that we can do as a breast center here, but also potentially, when we report these findings nationally, they can help patients everywhere.
I'm glad you brought that up because I was going to ask if this is something that eventually you want to see outside of Iowa, all over the country. But I did also want to ask you, what were the early results that you got? What were some of these pain
These
points?
things? Well, we found, I mean, one, it was nice to hear patients say, oh, my doctor explained things really well, or it helped, when they held my hand in the operating room or things like that. But we identified, I think, three key areas where support is needed. I think information is one of them, and information about things that as a provider for me, it might not even occur to me that somebody might not understand what this particular test is about, but just information on what to expect, what a test is like, what a test is for, what a procedure is going to be like, things like that. I think the second thing is coordination is super important. So trying to make sure that things happen together as much as possible. A lot of our patients come from far away. And then the third thing is support. So support in, mental health support, but also just support in things like, a nutritionist and so on. And we do these things, we have all of these pieces, but I think that there are lots of opportunities for making all of these better.
Well, before I let you go, Dr. Lizaraga, I am curious, do you see this as a trend, or is this something you'd like to see in healthcare more generally to move toward a more a mental health patient focused approach?
Well, I will boast because I'm a breast surgeon, and I think that breast care is miles ahead of a lot of other types of medical care where we really are particularly patient centered. And I think because we have so many different parts to what we do, we really have to focus on bringing those parts together effectively in a patient centered way. We are a national uh, accredited program for breast centers, and that is one of the standards. They revised their standards recently with a focus on patient centeredness. So I feel like we are sort of leaning into that trend. It is something that I'm hoping to see more nationally, but certainly we want to be excellent here at Iowa in providing that kind of service.
Well, we look forward to seeing the results of that study. Dr. Lizaraga, thank you so much for your time.
Hey, thank you so much for having me.
All right, I'm going to give you guys a second to pull out your phones. If you want to revisit this story or share it with your friends and family, all you have to do is scan the QR code on your screen. And if you missed this, of course, you can always find the article online on WQAD.com underneath the As Seen on TV tab.